It's a great pleasure to be here and to hear Jack and Adriana and Amanda speak, and hopefully we'll be able to talk a bit about it. I've been lucky enough to be Chief Medical Officer for the last 9 years, and about 1.5 years ago I became Chief Public Health Officer as well. And that's a great privilege to work with the hugely dedicated professionals, some of whom, like Julie Patterson, are in the audience, around the 3 areas of public health in South Australia, which are health protection, so clean air, clean water, safe food, health prevention, immunisations, screening for cancer. These are just some of the examples. And then health promotion, which is about being healthy and staying healthy. And these are where the challenges are, and some of them, I'm not sure we can see that one, but some of them are, oh, there we go, are really huge challenges. And one of the big challenges for all of us is around chronic disease. So where we are today and who we are today and how healthy we are today is predicated on where we have been and what we have done and how we have treated ourselves over the past. And so where we will be and how well we will be and what we will be doing is predicated on what we're doing now. And that applies with regard to chronic disease as it does with other things in our lives, our emotional states and a whole lot of other things. Chronic diseases are diseases that aren't cured, they are ameliorated. Some of them can be prevented by certain actions, and certainly the outcomes can be hugely improved by healthcare. But hospital care, GP care, primary care affects some of us at different times in our life. Public health and health promotion, health prevention, health protection affects all of us every day. So 2 of the biggest risk factors that now face us with regard to chronic disease are diet and how we eat, and obesity. Smoking has fallen off the scale a little bit, but still remains a huge challenge. And then there's high blood pressure, physical inactivity, and a whole variety of other things. In South Australia, SNAP, smoking, nutrition, alcohol, physical activity, are the main things that drive chronic disease and help to ameliorate chronic disease, help to prevent chronic disease. We're now seeing the benefits of the anti-smoking campaign. Lung cancer in men has been declining for a number of years, and for the first time in 2014, South Australia showed a decrease in lung cancer mortality amongst women. As you know, the tobacco industry targeted women for a long time, especially young women, and with the anti-smoking campaigns, we're now seeing rates here of sort of roughly 12%, and we're now seeing the benefits of that with a decline in lung cancer mortality for the first time. Sorry, I'll go back. The nutrition, 5 serves of vegetables, 2 serves of fruit a day. We are very poor at meeting our vegetable targets. Fruit, slightly better. Alcohol, large numbers of men have risky drinking. And with regard to physical activity, we are now beginning to see improvements in some areas, but in particular in the lower socioeconomic class, and with the changes in the way we live, with smaller backyards, larger houses, more screens, more screen time, activity remains a problem. How many people here have got a Fitbit or similar? Use their phones? Fantastic. We need to encourage people to become competitive in their activity, to be talking about activity, and to make our cities and towns much more livable in terms of walkability. And that's where partnerships come in, and it's great to see partnerships here as well. So cardiovascular disease, and I'm sure Amanda's going to talk about cardiovascular disease, so I won't go too much there, remains the most expensive and top of the 12 chronic conditions that we have. And that's despite huge reductions in mortality from heart disease over the last 20, 30, 40 years due to public health campaigns, blood pressure, anti-smoking and so on, reduced cholesterol, but it still remains a big problem. As I mentioned at the beginning, our health and wellbeing is determined by a whole spectrum of things, partly by our genetics, but also about how we act and what we do. And that's not just as individuals, that's as a society. So education, health literacy, our children understanding what to do from a very early age, us as adults and role models in our businesses and in our communities, showing them the way forward in terms of activity, healthy eating, healthy drinking, not smoking, a whole lot of other things. and then the individual things we can do for ourselves as well for the future. The social and economic determinants of health I started to mention. They relate to education, and Jack mentioned it. Education is a fundamental aspect of living longer and better lives. It is a social good. It is something that we do relatively well in Australia compared to other countries in terms of equity of access, but health literacy and improving education in general is a key component of living longer, healthy lives, as well as things like the environment, walkability. And SA Health has been partnering for a long time with councils and other agencies about trying to get health into all policies, and we're now talking about partnering with businesses about bringing a health lens to whatever people already do. So if they're going to do something like build a development somewhere, to bring a health lens as to how to make it a healthy place to live. These are some of the things that we do in SA Health, and I'll advertise the Get Healthy program in particular. Get Healthy program is a free coaching service that we pay for. You don't pay anything, you ring up, you get free coaching sessions, and it's available through our website. You can see the phone number, and it is an evidence-based program. It's shown to make people healthier, and it's currently not as well subscribed as we would like, so we would like anyone here to promote it, take it up yourselves, take it up with your family. Other things that we do are healthy legislation, so kilojoule labelling in fast food businesses that are multi-chain fast food businesses. Other simple things, scores on doors for food safety. Look for the 5 stars when you walk into a restaurant. That means that the kitchen is clean and safe and a safe place to eat. And then there are a variety of other things, regional public health plans with our councils. So as part of the Public Health Act, all councils must put forward a regional public health plan to me as the Chief Public Health Officer, but really for their communities. So I'll leave it at that and join the panel to answer any questions later.